So in the UK, we're running a study called the FiTNEss trial. This is a prospective randomized trial looking at using the IMWG frailty score to prospectively dose adapt induction therapy for newly diagnosed patients with myeloma who are not eligible for a transplant. So patients are randomized between that prospective dose modification based on the IMWG frailty score or the standard approach, which is to deliver standard doses of treatment with dose modifications based on toxicity developing. So this is a study led by Professor Gordon Cook and Professor Graham Jackson in the UK, but I'm involved in the trial as well. And we're hoping that this study will help to both prospectively validate the IMWG frailty score and demonstrate whether we can use it in this way to dose modify. Our hypothesis is that by doing that, we will be able to enable patients to stay on treatment for longer and gain more benefit from treatment, as well as having fewer side effects from that approach. I think this is a really interesting study. It's a different study, if you like, to lots of other studies that are going on in the world at the moment, looking at adding new drugs. It's about a different approach rather than a different drug combination or novel drug therapy. But it's really important because what we think is that it's likely to show that we can do this in this way. Some clinicians may think we should or can do that already, but this trial will really give us the evidence to know whether that's the right thing to do for our patients or whether we should be using standard doses and dose reducing based on toxicity.